Within public health, social media can play a huge role when responding to a disaster.
You're kind of making the news. You're not standing by anymore. You're actually becoming a part of the news.
Groups will use a variety of social media tools, including YouTube, Facebook, and Twitter, to get their message out to the public.
You can get correct information direct from the source faster than regular media.
The public doesn't wait. If you open the door and have a social media outlet, they expect answers. We have to find a modified system that allows us to better address the social media expectation.
We were actually given a grant through the CDC, which went through NACCHO, which is the National Association of County and City Health Officials.
What really drove, I think, us getting the APC grant was the ability, one, to be innovative. I think that's the main issue here. But then also, two, that we can deliver what we were going to actually do.
And that allowed Toledo-Lucas County Health Department to utilize their creativity and innovation to develop these toolkits and products for other local health departments.
During a disaster, it's imperative to get your message out to the public. Social media is a tool that we can use to help get that message out. But there's a lot of confusion on how to effectively use social media, and that's why we're throwing this training event.
The event is called Instantly Informed Social Media Training for Public Health Emergencies.
We've invited people from all different organizations who would respond to disaster to the training event.
This is the third year that we've done an event, and every year it's getting bigger, it's getting more involved. People coming from different areas that we haven't seen before.
My name is Kathy Silvestri. I'm the Northwest Ohio Regional Healthcare System Coordinator for Disaster Preparedness. I represent 32 hospitals in 18 counties. We have a lot of incidents that occur in Northwest Ohio, and social media is always a factor. So I'm really looking forward to getting some ideas today.
Gloria Arps. I'm a registered nurse and I'm a public health emergency coordinator for Henry County Health Department. I know social media is a very important way of getting information out to the public nowadays, but I'm not for sure I know how to put it out there in a proper way for my organization to get it to the public.
For those that can attend, we're going to simultaneously webcast the event, so people from all across the country are watching this in real time.
The webcast helps us reach a broader audience because we're able to take that initial presentation, which would only have been viewed by the people in the room, and expanding it to all the different APC centers around the United States, plus some of the EMA and other health departments around the U.S.
After registrations, participants are going to listen to two experts talk about their use with social media and public health.
I just spoke about Morris County's experience with Hurricane Irene and the Halloween snowstorm, how we had set up in advance theoretically what we had put together, and then in actuality what happened, things we would have done differently, and some recommendations.
I think that we have to accept that social media is the way that people want us to engage, and since we're in the business of public service, it's the way we need to go. Training is the way to break down the walls. And everybody can do social media. It just takes somebody to show you that it's as easy as we say it is.
In the afternoon, we have Adam Crow coming in from Virginia Commonwealth University, and he's a social media guru, and he's going to help people understand what role social media plays in a disaster.
We worked with the Northwest Ohio PIO group, wanted to design an exercise where they could have real-time simulation of social media, such as Twitter and Facebook. However, to make sure we didn't interfere with real information that was going on the systems, we utilized Simulation Deck by a group called Nusura.
Simulation Deck is going to provide real-time injects via live video, Facebook, and Twitter feeds.
We had everybody split up into random groups. We had 12 different groups. So they had to go through and monitor on their own. There was no news feed. So they went through and monitored exactly the different things that were coming out, and then they had to go back and make posts about it.
Now, these reports are very preliminary, and we don't know how much damage, if any, these tornadoes have caused. But it is clear that there are tornadoes on the ground in several parts.
There have been confirmed tornadoes in Northwest Ohio.
We are going back and forth. My main ones are Bleeder and Simbook, which is the Facebook and Twitter. Just going back and forth between them, finding our different characters and posting.
I think a lot of people learned today how to actually go and work with each other, and then we'll go back to the table and then create a plan that's going to be able to use social media and to collaborate with everybody in the event of a disaster.
I think we got a lot of work to do because we've got to develop policies at the county, local level first, and then feed it into the region.
It takes a lot of work, a lot of effort. We got to get some policy and procedures in place so we can respond like that, because you don't have much time to respond with the right answers.
I think in general there is a swing in the public's expectation for what they think government providers, including public health, should be able to do.
Well, I hope at least 75% of the people in this room go out and get themselves on Twitter, on Facebook, and start sharing, because at least 75% of their constituents are already in those spaces.
I think social media is evolving and growing in disasters. You're finding more people that are making the news live and making it happen as is.
At the end of the day, utilizing social media in your risk communication plan can help save lives.